All right, thanks, Joey. Time now for a check of our top stories. And the Firefighters Union of Puerto Rico declared a, quote, red flu of closed stations and absent firefighters that respond to a protest of movement for the low pay, poor work conditions, and to seek better retirement benefits. Our Francis Felix reports.
This week, firefighters decreed a red flu in claim for better salaries and greater retirement benefits. The president of the United Firefighters Union of Puerto Rico, Jose Tirado, affirmed that the absence of firefighters will continue to escalate. The firefighters are demanding a raise of $500 for this year and another $500 for 2023. So their base salary rises from $1,500 to $2,500 per month, and that they be included in the dignified retirement approved for the police. According to Tirado, the government negotiated firefighters were excluded even though they are in the Department of Public Security. Firefighters work under the same conditions as police officers, but they earn $1,000 less in base salary compared to the police. Also, the union held a meeting with the Secretary of the Government, Noelia Garcia, that they described to be disappointed after not obtaining guarantees, nor will they be given greater retirement benefits. The union will cancel its registration to determine how long the red flu, absence, and closed stations extends and ponders other pressure mechanisms, among them a massive demonstration during the next weeks in La Fortaleza. From San Juan, Puerto Rico, Francis Felix.
All right, thanks so much, Francis. Well, meantime, the U.S. is now averaging more than 385,000 new COVID-19 cases a day. Now, that's a drop of 37% since last week. And that has some health experts rethinking the benchmark used to measure the state of COVID-19. Our One Caribbean News' Emily Matson has a look into why U.S. federal health officials are not ready to ease restrictions despite the low numbers.
There are growing signs that the U.S. could be ready to ease COVID-19 restrictions and start moving back toward normal.
I can't tell you exactly when, but there are more and more positive indicators each day that tell us we are making progress to that final goal.
The average number of new daily cases is down 37% since last week and is trending down in all but one state, Alabama. And as the Omicron variant appears to be receding, some health experts are asking whether it's time to roll back some COVID-19 restrictions and end mask mandates. On Wednesday, the White House declined to say when the administration would offer a clear plan to transition out of the pandemic, with the CDC director saying she's cautiously optimistic.
We really do have to look to our hospitalization rates and our death rates to look to when is time to lift some of these mitigation efforts. We will continue to reevaluate, and we know people are anxious.
However, CDC data shows the average daily number of COVID-19 deaths is up 6% from a week ago. And while hospitalizations are down 15%, health experts say the rates are still high and could threaten capacity at some hospitals across the country.
This is a virus that's still adapting to people, and people need to adapt to the virus.
And as a new report finds, unvaccinated people are 97 times more likely to die of COVID than those with a booster dose. Health officials reiterate the best protection against coronavirus is vaccinations.
Data are really stunningly obvious why a booster is really very important.
Emily Matson, One Caribbean News.
All right, thanks so much, Emily. Well, meantime, the Prime Minister of Belize is now recovering from his second infection of COVID-19. Several days after winning the November 11th of 2020 elections, the Prime Minister contracted the virus. He is believed to have contracted it again during a work trip to Honduras just last week, where he attended the inauguration of that country's new president and also attended several diplomatic meetings. The Prime Minister tested positive after returning to Belize. He told Love FM that he was doing well.
I am probably one of the lucky ones that is asymptomatic. As you remember, the first time around, I had no symptoms. And now the second time again, I have no symptoms. But I've been locked up in my bedroom working Friday, Saturday, Sunday, Monday. And today we had Zoom meetings, cabinet meeting, and also parliamentary caucus, which We just finished a short while ago, so it's been a very, very long day. But thank God I am doing well, and I want to thank all Belizeans who have been expressing concerns about my health and their support.
You don't say to a woman?
Hang on. Shh. And now the Prime Minister used the opportunity to urge Belizeans to get vaccinated.
You know, that's the only way we're going to fight off this virus. That's whilst it's not as deadly as the Delta, it is still a nuisance and hindrance for us to going back to our daily lives, not to what we used to before April of 2020. And the only way the quicker we could get to that is by getting vaccinated and at the same time to social distance, wear a mask and wash your hands.
And switching gears now, Southwest Airlines says it will resume selling alcohol on flights starting February 16th. Passengers will be able to buy beer, wine, and liquor on flights of 176 miles or more. The selection of non-alcoholic drinks is also expanding to include tonic water, apple juice, hot tea, and cocoa. Sales were suspended early on in the pandemic and kept off limits during a spike in unruly behavior among passengers last year. And Friday is National Wear Red Day, and the American Heart Association hopes to raise awareness about the #1 killer among women. Danya Bukas has the story of one woman who suffered a heart condition that's on the rise among females.
75-year-old Dr. Elaine Camille spends her days caring for children with kidney disorders. After a work trip in 2013, she experienced chest pain and shortness of breath.
I actually had been seeing a cardiologist for a few months beforehand because I've been having some chest discomfort and my evaluation was fine.
She was diagnosed with broken heart syndrome, which causes weakness of the heart muscle, often triggered by emotional or physical stress. While considered temporary, up to 10% of patients will have another event within 5 years.
We lost one of our sons at the very end of 2009. I'm pretty sure I had another episode back then.
Heart disease is the #1 killer of women.
The Women's Heart Alliance has launched a new awareness campaign.
We are doing this because of the rising cardiovascular death rates in women, particularly younger women under the age of 50, and particularly women of color. And this started before the pandemic, but it has been exacerbated by the pandemic.
Dr. Noelle Berry-Mers with Cedars-Sinai Medical Center says the warning signs are not just chest pain.
Women will have other types of symptoms, and this is why they get misdiagnosed: indigestion, overwhelming fatigue, shortness of breath, radiating pain into their jaw or their shoulder.
Research shows broken heart syndrome is on the rise in middle-aged and older women.
I go for regular follow-ups. I take my medications faithfully. The hard part is, I guess, psychologically, knowing that you had this problem and not being worried constantly it's going to come back.
Dr. Camille is part of a Cedars-Sinai study to help doctors better understand the condition. She hopes more women take charge of their heart health.